Welcome to HIMSS TV. I'm Sarah McGeet. I'm the Associate Editor at HIMSS EMEA. Today, I'm delighted to have with us Dr. Deborah Maufi, who is the Chief Medical Officer at Babymoon Care, and she'll be speaking at the HIMSS European Health Conference on the session covering health inequalities levelling up beyond COVID-19. So obviously a very big and important topic in the current situation, and we really look forward to hearing more about. So thank you very much for joining us today, Deborah.
Thank you for having me, Sarah.
I wonder if we can start off by talking a bit about your role at Babymoon and the great work you're doing there.
Yeah, so Babymoon, we are a startup based in the Netherlands, and we are focused on promoting baby wearing in a more health-related situation, because at the moment, baby wearing is more just as a transport device to help mothers be more mobile. But with Babymoon, our mission is to promote baby wearing from prematurity onwards till a toddler. So from 1.5 kilograms all the way to 3 kilograms. And this is because, the World Health Organization and other associations have recommended that infant carrying attachment of mother and child is very crucial for the physical, mental, and social well-being of both the mother and child. So we do this by creating solutions, so carriers with a very tight buckling system, so it's excellent adjustability and even weight distribution to support the mother's physical being and the baby's positioning as well. And my role there as a chief medical officer is to develop and implement this healthcare strategies in different facilities globally. So we are working on clinical validation projects in Africa, in Tanzania. Now we are setting up one with a government hospital there to support care for premature babies and babies with low birth weight. But also we are also setting up clinical validations around Europe, and that's where my biggest input comes in.
Thank you, Deborah. Sounds like you're doing some great work and making some excellent changes in this area. And I want to ask, obviously, how has COVID impacted maternal and newborn health in particular during these last few months?
Well, COVID has affected everyone for sure, but specifically when we talk about mother and child health, we see that pregnant women, for example, they are not at a higher risk of getting COVID as related to non-pregnant women. But when they get COVID, they are predisposed to more adverse outcomes. And not only that, because the focus has really shifted to COVID globally at the moment, so other primary health services are sort of getting a bit neglected. So we see that the pregnant women or mothers of newborns, they don't attend clinics, prenatal clinics or postnatal clinics, because lockdowns and shift of focus, but also lack of resources in specific areas. And not only that, but also nutrition-wise, because breastfeeding, COVID is a contact pandemic. So therefore, everyone wants to keep their distance, and there's a lot of misinformation and a lot of new mothers who do not know that they can continue breastfeeding because COVID is not transmitted through breast milk. But because of this misinformation out there, or uninformation as well, parents tend to get separated, and this affects breastfeeding practices from early initiation of breastfeeding to exclusive and continuous breastfeeding. And as we know, breastfeeding is very important in the health outcomes of newborns. And it can save up to over 800,000 newborns just breastfeeding itself. And with the pandemic, we see that this is becoming a problem, which also affects the mortality rates of both mother and child. And of course, the trajectory of progress for the Sustainable Development Goals. But also we see that there's less, the numbers of delivery by skilled attendants in the hospitals also is being affected, because then pregnant women are scared to go to the hospitals they're afraid that they might contact COVID in the hospitals or not. So then they end up with home deliveries or in situations that are not that do not provide good quality of care. So we see all these things, and the pandemic has really affected maternal and child health greatly. Yeah.
Absolutely. And obviously it's really brought to the forefront the health inequalities as well that we've experienced. And I wanted to ask you, what are the most pressing health inequalities, in your opinion, that need to be addressed, particularly after COVID? What's really been brought to light during this time?
I would say the importance of digital transformation. Digitalizing the healthcare systems could really take us a long way. And when I say digital transformation, it's not just about bringing digital tools, digital health tools to the community or to the healthcare workplace. It's also about building capacity on digital literacy, because as much as digital transformation is an amazing thing, the end user must be able to use it for it to actually make an impact. But we have a big digital divide between the old population, female, different communities, different underserved communities that also we need to build their capacity so that they can have access to quality healthcare in a digitalized world. I mean, COVID has shown us that everything is going digital and should go digital to make work easier for everyone and life easier for everyone.
Yeah, some great points, and we really kind of hope to see that digital will really bridge these gaps even more. And finally, Deborah, I just wanted to ask you, is there anything that our audience can look forward to hearing about from you ahead of the HIMSS European Health Conference?
I think I would like to amplify a lot on the importance of reorganizing and reforming our healthcare systems. This pandemic has brought to light a lot of health inequities and how we can transform our healthcare systems to be able to provide quality care, but also to improve the health-seeking behaviors of the community. So, including information sharing, learning from best practices of other countries. I want to bring this to light and also advocate for more diverse and inclusive healthcare workforce, because the healthcare workplace is a very homogeneous environment, but it caters for a very diverse population. And for one to be able to provide a good standard of care, and for people in the community to realize their full health potential, they do need to have a diverse workforce as well to be able to understand and communicate differences, social differences, cultural differences, creed differences that might affect the service that they receive, and also improve their health-seeking behaviors. So this is one area that I would really like to touch on our way forward post-COVID.
Thank you. Some really insightful takeaways there. It's been great to check in with you on the world of health equity and maternal health, and we really look forward to having you at the European Health Conference. Thank you very much, Deborah.